This is a brief summary of the UPLOADS National Incident Dataset Annual Report. This data was collected from the 1st of June 2015 to the 31st of May 2016. This project was supported by funding from the Australian Research Council in partnership with the industry organisations you see listed here. "19 organisations from across Australia contributed data to this report. These were 8 camps, 5 commercial enterprises, 4 schools and 2 registered training organisations. Overall, 485 incidents were reported over the 12-month period. These included 351 injuries, 74 illnesses and 34 near-miss incidents. The overall injury incident rate was 2.1 per thousand participants across all activities. This finding indicates that the injury incident rate for lead outdoor activities is relatively low compared to other popular organised sports in Australia. This injury rate is actually the same as what was found in the first 12 months of data. Taken together, these analyses suggest that the injury rate for lead outdoor activities in Australia is not only low, but is also relatively stable. The activities with the top 5 highest injury incident rates were wheel sports such as mountain biking with an injury incident rate of 8.8 per thousand participants, trampolining which had an injury incident rate of 7.1 per thousand participants, walking and running in the outdoors which had an injury incident rate of 5.7 per thousand participants, camping in tents, which had an injury incident rate of 4.8 per thousand participants, and free time outdoors, which had an injury incident rate of 4 per thousand participants. Free time outdoors and walking and running in the outdoors have recorded a relatively high injury incident rate over the last 2 UPLOADS annual reports. As organisations continue to contribute data to the UPLOADS National Incident Dataset, activity-specific incident trends may be able to be identified. However, it is too early to do this at present. These incident rates identify the types of activities which may require further risk management. However, it should be noted that over half of all activities had an injury incident rate of less than 1 per thousand participants, suggesting that the strategies used to manage the risks associated with these activities are somewhat effective. In addition to the relatively low injury incident rate, the vast majority of incidents were rated as having only a minor short-term impact on participation, that is, they had a severity rating of 1. Wrists and hands, ankles and feet, and knees and lower legs were again the most frequently injured body parts by dislocation, sprain or strain, or superficial injury, for example abrasion, blister or insect bite. Only 19% of these incidents required evacuation, and less than 5% of the injuries reported required hospitalisation. The contributing factors and the connecting relationships provide some important conclusions regarding accident causation and prevention. These are represented here in an axis map. By examining the network of contributing factors identified in the injury incident reports, prominent contributing factors from across the lead outdoor activity system are revealed. Contributing factors were identified across the lower 4 levels of the UPLOADS Accident Analysis Framework. These included communications between parents and carers and activity providers, for example failing to communicate about a participant's dietary requirements or pre-existing condition. Multiple factors associated with activity of participants were also identified, including things like their judgment and decision making, experience and competence, compliance with procedures, and communication following instructions. Factors within the activity environment such as infrastructure, vegetation and animal and insect hazards, as well as the activity equipment and resources, were also identified as contributing factors to injuries in the lead outdoor activities. These findings are consistent with the first UPLOADS report and provide further evidence that lead outdoor activity injuries represent a systemic issue. A key implication is that the prevention strategies developed by organisations and the sector should focus on factors across the sector as a whole, rather than only on individual instructors, equipment, and the environment. It is important that discussions around systems reform for injury prevention involve actors from all levels of the system. Reducing the frequency of these factors could represent appropriate goals for injury prevention activities. However, a network of prevention strategies would be required to achieve them. It is proposed that this network should include interventions targeting at least the 4 lower levels of the lead outdoor activity system. Although activity participant factors are prominent in this dataset, targeted interventions require modifications to all parts of the system, including activity leader procedures and program design. To illustrate a systemic prevention strategy, let's look at the key factors and relationships that were identified in the current dataset. Activity participant experience and competence was identified as a key factor and was related to activity participant mental and physical condition. A potential prevention strategy for this interaction might be include skill-based levels of participation within the program design to reduce anxiety and improve competence. Activity experience and competence was also seen to be related to activity equipment and resources. A potential strategy for this might be to ensure adequate demonstration and familiarization in the program design to ensure activity participants know how to use the equipment required for the activity. Activity infrastructure and terrain was also identified as a key contributing factor to injuries in the outdoors, and this was related to activity participant mental and physical condition. A potential prevention strategy for this might be to inspect the infrastructure and terrain before booking an activity to ensure it is appropriate for the mental and physical conditions of the clients. This has just been a summary of the full annual report released by the UPLOADS project. We encourage you to access the full written report on our website, as it highlights a number of important issues relating to incidents and incident causation in lead outdoor activities, as well as incident reporting within the sector. We hope that this information helps the lead outdoor activity sector to better understand the risks that they face while providing an evidence base for taking appropriate action. If you have any questions about the UPLOADS project or would like to contribute to the National Incident Dataset, please contact Dr. Amanda Clacy at aclacy@usc.edu.au.